I'm going to present the results on the FujiLAM study. I will start with the diagnostic performance of the novel FujiLAM assay to detect tuberculosis in HIV-positive patients. As you all know, tuberculosis is the leading cause of death among people living with HIV, and diagnosis remains a big challenge to fight this disease. Patients are often not able to produce a sputum sample, or sputum-based tests are not available, and this is why urine-based tests are potentially a good help for diagnosis in TB. So we have one urine-based point-of-care test available. This is the Abbott TB-LAM test, formerly called FujiLAM, and this test produces results in 25 minutes, and it's a simple test to perform with two steps. You drop you put one drop of urine in the test strip, and then you can read the result in around 25 minutes using a reading card. But this test has also a limited performance, diagnostic performance, with a sensitivity of around 45% in patients HIV positive with less than 200 CD4, and lower sensitivity in patients with higher CD4 counts. The FujiLAM test is a novel LAM test. It's based on the same similar technology. However, this test is expected to have a better diagnostic performance. This test is also urine-based. It's also point of care and produces results in 1 hour. It's still not commercialized, but it's a bit more complex to perform than the Abbott TB-LAM test that is currently available and recommended. Let me show you how this test is performed. So briefly, you will add urine into a tube that contains a reagent. You will incubate the urine, so you will wait for 40 minutes, and then you will add 2 drops of this mixture to the cartridge. You push one button, wait 10 minutes, you push another button, and then within 10 minutes you can read the result that becomes as positive or negative. So the FujiLAM study had a primary objective that was to assess the diagnostic performance of the FujiLAM assay in ambulatory HIV-positive patients, and some secondary objectives to assess the mortality at 6 months according to the FujiLAM result, the feasibility of using the FujiLAM and the acceptability by health workers, the patient's perspective in providing a urine sample for TB diagnosis, and to assess the prevalence of exposure and infection to COVID-19. I will present the results of the diagnostic performance and the mortality at 6 months, and my colleagues will present just after me the results on the feasibility and acceptability and the COVID-19 ancillary study. So this was a multicentric study. It has been conducted in 4 sites. Here in Mbarara in Uganda, in Homa Bay in Kenya, in Maputo in Mozambique, and in Eshowe in South Africa. For the diagnostic performance assessment, we conducted a diagnostic prospective study. For assessing the feasibility and acceptability, we conducted a mixed method study, and for patients' perspective, a qualitative study. And we also conducted a COVID-19 ancillary study within the FujiLAM. The study was done between August 2020 and April 2022. So for the diagnostic study, the population were ambulatory HIV-positive adults who had whether signs and symptoms of TB and were recruited regardless of their CD4 count, and this was patients in group 1, and we had a second group of patients that had no symptoms of TB but had advanced HIV disease. And all patients received a clinical examination, a CD4 count. FujiLAM and Abbott TB-LAM were done in urine. Expert ultra was done in sputum or in urine, and a culture was also done in sputum, and all patients were also had also a chest X-ray. The microbiological reference standard for the assessment of the diagnostic accuracy was based on the expert and the culture results. And patients were followed up for 6 months. So in total, 1,575 patients were included in the FujiLAM study. As you can see in the table, 1,031 were included in group 1, so patients with symptoms of TB regardless of their CD4 count, and 544 patients were included in group 2, so patients with no symptoms of TB but with advanced HIV disease. You can see in the table that patients in group 1 had a high CD4 count, around 500 median, and this is because patients were recruited regardless of the CD4 count. And patients in group 2 had a median CD4 count low, around 130, as these patients had all advanced HIV disease. Almost a high majority of the patients were on ART, whether in group 1 or in group 2, 90%, and few were seriously ill. So this table shows the results, the positive results of the TB diagnostic test. FujiLAM and Abbott TB-LAM were positive in around 17% of the patients in group 1 and 14% of the patients in group 2. You can see that 9% of the patients in group 1 had confirmed TB disease with expert or culture, and 3% of the patients in group 2 had confirmed TB disease through expert or culture. And if we add patients with probable TB, diagnosed through chest X-ray or clinical signs, 13% were diagnosed with confirmed or probable TB in group 1 and 5% in group 2. Here in this graph, you can see the FujiLAM and Abbott TB-LAM results in patients with confirmed TB disease, with confirmed TB in group 1 and group 2, and in patients with no TB. If you look first at the first bar, you can see in dark blue that 1/3 of the patients with confirmed TB had a FujiLAM and an Abbott TB-LAM positive. 27% had only a FujiLAM positive, and 9% had only an Abbott TB-LAM positive. So this is to see a bit the added value of this test to diagnose TB. In group 2 patients, so patients with no symptoms of TB and advanced HIV disease, 22% had FujiLAM and Abbott positive results, 39% only FujiLAM results. And patients that were classified as not TB, 4% had FujiLAM and Abbott positive results, and around 8 to 11% only FujiLAM results positive or only Abbott positive results. And this slide shows the main results of the study. So that was the diagnostic performance of the test. So we compare the FujiLAM results with Abbott TB-LAM. On the first column, you have FujiLAM diagnostic accuracy, and on the second column, Abbott TB-LAM diagnostic accuracy. So if we look first to the sensitivity, you can see that among all patients, the sensitivity of FujiLAM was 60%, and if we compare this with Abbott, it was higher. Abbott was 40%, so around 20% of difference. If we now look at the sensitivity by CD4 count in patients with symptoms of TB, you can see that the sensitivity FujiLAM is higher across the different CD4 counts cutoffs, so around 70% in patients with CD4 less than 200 and 200 to 350, compared to 60% for Abbott in those with less than 200 and 37 in those 200 to 350. And in patients with CD4 higher, more than 350 cells per microliter, the sensitivity of FujiLAM was 34% compared to 17% for Abbott. For group 2, also the sensitivity was higher for FujiLAM. Now, if we look at the specificity of the test, the specificity was similar for the two tests, around 86%. This graph shows the same information. It's just presented differently. You can see FujiLAM is on top and Abbott is below. And you can see on the left the sensitivity and on the right the specificity. So you see that the sensitivity is higher for FujiLAM overall with a similar specificity. It's also higher in patients with less than 200 CD4 with similar specificity, and in those with more than 200 CD4. And we find the same results in patients with symptoms of TB, group 1, and in patients with no symptoms of TB and advanced HIV disease. However, we received information after ending the study by the manufacturer that there could be a potential difference in the diagnostic performance of the FujiLAM test by lot of tests. So we went back to our data and looked at the diagnostic accuracy of the test by lot of tests received. And we found that there was a difference by lot. If we look first maybe at the specificity, we saw that the lot 19003 had a specificity of 77%, while lot 20002 had a specificity of 91%, and lots 20003 and 20004 had a higher specificity of 97%. And we compare this specificity with the Abbott in the same patients, so by FujiLAM lot, and we saw that for this first lot, 19003, the specificity was lower for FujiLAM, while for the other lots was similar or higher than the Abbott TB-LAM. Now let's look at the mortality. So we look at the whether FujiLAM result was associated with mortality. As we know that for the Abbott TB-LAM positive results are associated with a higher mortality, and Abbott is able to identify patients at higher risk of mortality. So you can see in the table, well, now you don't see, but now you see again. You can see in the table on the left is the patients with symptoms of TB, and this is the mortality at 6 months of follow-up. So patients with a FujiLAM positive results and less than 200 CD4, the column on the left, had a mortality at 6 months of 20%, compared to 5% in patients with less than 200 CD4 and a FujiLAM negative test. For patients with more than 200 CD4, there was also a trend for a higher mortality in those with a FujiLAM positive test, 4% compared to 2% for those with a negative test. And on the right, you can see patients in group 2, those with no symptoms but advanced HIV disease. And also we see the same trend. FujiLAM positive patients had a higher mortality than those FujiLAM negative. And now in the graph you see the same information. So the mortality is on the y-axis, and the follow-up of 6 months, the time is on the x-axis, so 0 to 6. And you can see how the mortality increased in the patients with a positive FujiLAM result and less than 200 CD4, that is the red line, compared to those with less than 200 CD4 but a negative FujiLAM test, that is the blue line, and the dot line is the patients with more than 200 CD4. Now, if we look at the risk of mortality in multivariable analysis, and we compare FujiLAM positive with FujiLAM negative again, but adjusted for other characteristics of the patients, including gender, age, BMI, or CD4 count, we can see that we confirm the results that I just presented, with a higher risk of mortality, 5 times higher for patients with a FujiLAM positive result compared to those negative result in patients with less than 200 CD4, and a similar trend that is not statistically confirmed in those with more than 200 CD4 and in group 2 patients. So in conclusion, we saw that FujiLAM has a higher sensitivity than the currently recommended Abbott-TB-LAM. This test can detect patients at high risk of mortality and can be a potentially benefit and rapid for simple TB diagnosis. However, the variability in accuracy between lots needs to be addressed before further recommendation. I would like to thank all the patients that had participated in this study, MSF and Epicenter colleagues, the study scientific committee, the Ministry of Health of the countries involved, the founders of the study, and the FIND who provided the test. Thank you very much.